Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about dizziness after knee replacement surgery. What are some of the causes, and what are some of the things we can do to manage and treat it effectively? Before I jump into that, be sure to hit the subscribe button, turn on the notifications, catch all of our latest videos. So, dizziness can present itself in a lot of different ways. It can be a feeling of spinning, like you're spinning or the room is spinning. It can be a feeling of lightheadedness. It can just be a feeling of unsteadiness or disequilibrium as well as some other potential characteristics and sensations. When it comes to dizziness, it's really important to address it and manage it effectively. One, it's just going to be uncomfortable and you're going to feel miserable, and it's just a very unpleasant sensation. But two, it's just from a standpoint of safety, reducing your risk of having a fall or other issue, and being able to tolerate your rehab and your recovery and just life in general after a knee replacement surgery. So very important to get it managed effectively. There are a handful of different reasons why you might have an increased chance of dizziness after knee replacement surgery. So one of them is due to medications. So opioids or pain medication, potential side effect very common with these medications is dizziness, fall risk, feeling of sedation, as well as if you're on any blood pressure medications. Lightheadedness causing a drop in your blood pressure can also cause some dizziness as well. Something as well after surgery is the risk of orthostatic hypotension, which basically is the medical term for low blood pressure. Again, this can be due to medication, or it can be due to some of the side effects of anesthesia and just everything you're going through with surgery and recovery afterward. So that's another potential risk, is that drop in your blood pressure, or most commonly with changing position. So for example, when you're getting up first thing in the morning, or you get up in the middle of the night to go to the bathroom, you might feel a bit of that unsteadiness or lightheadedness. That's most likely orthostatic hypotension, or low blood pressure, or a drop in your blood pressure with a change in position. Another risk is dehydration, so not taking in adequate fluids, which may cause some dizziness as well. Sedentary lifestyle, potentially after surgery, you're in a lot of pain, discomfort, your body's healing, you're trying to get some rest, and you might just not be as active as you are normally. This may have greater impact if you have some underlying heart or lung cardiovascular concerns, which may present and cause some dizziness as well. You may have extreme pain, and you may have anxiety from that pain, or a combination of the both. Anxiety, especially when it's in the form of fear of falling or feeling unbalanced or unsteady, can definitely cause some disequilibrium, unsteadiness sensations. And you might just have an issue with your vestibular system. So you may have vertigo or some form of vertigo or balance related issue from your inner ear, from your vestibular balance system. So what can we do to effectively manage these things? Well, one is with medication, definitely keep an open dialogue with your doctor and healthcare providers. If you are experiencing dizziness or any other symptoms, let your doctor know that. There may be things that can be adjusted in terms of dosing, timing of when you take different doses, may try alternate medications. There's a lot of different options to adjust your medication if that is potentially what's causing your dizziness or issues. Something also to keep in mind is maintaining good hydration and nutrition throughout your rehab and recovery. So taking plenty of fluids throughout your whole recovery process to prevent the negative impacts of being dehydrated, and just maintaining a good, healthy, balanced diet, getting plenty of food, fruits and vegetables and nutrients. Plenty of protein is also going to help building your muscle and strength after surgery. So maintaining a good diet, drinking plenty of fluids to help reduce the risk of being dehydrated. Maintaining and practicing good mobility practices. So when it comes to early recovery, maybe that's using an assistive device or using a walker. It may be continuing to train and practice with your physical therapist to build strength, to build balance, stability, and coordination, and comfort with different movements and activities and dynamic challenges. So safe mobility practices and trying to practice and improve that and train your mobility, coordination with your physical therapist, with your healthcare team. Managing pain effectively, of course, is extremely important. Using a multimodal approach through medicine, either opioids, anti-inflammatories, acetaminophen or Tylenol, as well as non-pharmacological, icing, heat, positioning and elevation, and gentle movements. As well as dealing and trying your best to manage and deal with any psychological concerns, anxiety, depression, just general stress, trying relaxation techniques or other techniques, meditation, mindfulness, and seeking professional help if that is appropriate and seems appropriate. And don't hesitate to do that. It can be very valuable and very helpful to have a successful recovery overall, not just preventing dizziness. And then the last thing is consultation with your healthcare providers. We already talked about the physical therapist, who of course can address any issues with disequilibrium, feeling unsteady, feeling unbalanced, and working on those. If it is an issue with your vestibular system and you're having some vertigo, there's a variety of techniques that your physical therapist can help you with and to help address that effectively. And if it is something that persists, where you continue to have dizziness or concerns related to dizziness or unsteadiness, is seek the help of your doctor. Your doctor can get you in contact with a professional and the appropriate medical professional to manage and deal with it effectively. And like I said, it's very important to do so because dealing with dizziness is just another thing to add to an obstacle to an effective and efficient recovery. So dealing with it proactively is very important. I hope you found this video helpful. Please be sure to hit that like button, leave your comments and questions below, and as always, thank you for watching.